Put your elbow up, son! Elbow up!
I go to the right.
Run, John, run!
Mikey, baby.
Somebody call an ambulance!
Mikey.
Michael, somebody call a friggin' ambulance!
Surgery is very expensive. In most cases, prohibitively so.
Yo, we got insurance. I mean, major medical, he's covered.
We've already checked with your carrier, Mr. Archibald. There are no provisions in your policy for a procedure of this magnitude.
Oh, no. That's a mistake. I mean, I'm not just you're making the mistake. I'm just saying that I'm insured. My son's covered.
How about you, Mrs. Archibald? Do you have coverage?
No, I've only been working at the supermarket a couple months, and you don't get benefits until you...
Doesn't matter. We got insurance.
Okay, I can see here that you don't own your home. You have no stocks, no bonds, no investments. You have a little over $1,000 in savings.
But we got insurance.
That may very well be, Mr. Archibald. You're going to have to check with your carrier on that. In the meantime, I'm afraid we're going to have to treat this as a cash account.
What?
How much does a transplant
Wait
cost?
a minute, baby. Let me take you. How much does it cost?
Transplant, surgery, doctor's fees, post-operative care, immunosuppressant drugs. You're looking at a minimum of $250,000. Wow. If you opt for transplant surgery, that is your choice. But the hospital maintains a very strict policy with regard to cash patients. We require a down payment before we can put a patient's name on a receiver's list.
How much?
What kind of down payment?
30%. $75,000.
$75,000. To put my son's name
Our
on
son
the
is
list.
upstairs dying, and all you can do is sit here and talk about money?
It costs money to provide health care. It's expensive for you, it's expensive for us. Now, I'm sorry, but you're going to have to guarantee payment before I can put your son's name on the list.
No.
No what?
No, you don't qualify.
My son is dying. I'm broke. If I don't qualify, who the hell does?
I'm sorry.
You're sorry? I don't need you to be sorry. I need you to help.
You know what I don't understand is why they never found it, the doctors.
My son has had clean checkups every year since the day he was born.
How could the doctors not pick it up?
He might not have been tested thoroughly enough.
Why not?
Look, you got an HMO, right?
Yeah.
Well, there's your answer. I mean, HMOs pay their doctors not to test. That's their way of keeping costs down. Now, let's say Mike did need additional testing, and insurance says they won't cover them. The doctor keeps his mouth shut, and come Christmas, the HMO sends the doctor a fat-ass bonus check.
Is that true?
Possible. Not likely, but possible.
You telling me that these doctors may have known what was wrong with my son and they could have treated him all along?
Who knows? I don't know, John.
Don't take this personal, Doc. Y'all a bunch of goddamn crooks.
You don't know what you're talking about.
What about that thing that you guys take?
The thing?
Yeah, that promise. What do they call it?
It's called the Hippocratic Oath.
More like the hypocritical oath. How's it go, Doc? I solemnly swear to take care of the sick, damn near dying, unless they ain't got major medical. Something like that.
You got it perfectly. That's it.
It's funny, but it's not that far from the truth, okay? And this shit happens all the time. Paramedics bring in some accident victim, and when the big boys in accounting find out they can't pay, they send them packing.
Hospitals can't turn people away.
Isn't there laws against that?
Yeah, there's laws, but there's also ways around those laws. The only thing we have to do is stabilize them, and after that, we're off the hook, and you know it.
That's not how it works.
That's exactly how it works. Maybe not up there on the 5th floor, but in here, if you don't have any money, you get a Band-Aid, a foot in the ass, and you're out.
He's very sick. And he needs some help.
I understand. It's hard to be a man these days. Hard to know what the right thing is. But put the gun down, John.
You're not hearing me, Frank. My son is sick. That's it. There's nothing else. End of story. When people are sick, they deserve a little help. Yeah! Sick help. Sick help. I am not gonna bury my son. My son is gonna bury me.
We go now to Hope Memorial Hospital. Live, Tuck Lampley.
As you can see, the crowd here in front of Hope Memorial is growing. The SWAT team has arrived and the situation is becoming very tense. Standing next to me is James Palumbo, friend of John Archibald. Mr. Palumbo, what can you tell us about John Archibald?
You know, I gotta be honest, Tuck. I mean, this whole thing sucks. You know? I mean, it all could have been avoided so incredibly easy. I mean, none of this had to happen if John had just been a friggin' millionaire, right? Or if his last name was Rockefeller. But, you know, sometimes John don't get it. He don't understand that what we hold sacred in this country isn't values. It's value that's important. We got haves, we got have-nots. We got white collar, blue collar, and then we got no collar. Inside there, we got surgery, we got outpatient surgery, and we got out-of-luck surgery. There's a lot of people out there, Tuck. A lot of people here who don't got 250 grand in their billfold. To shame a man like that and back him into a corner. Seems to me that something is out of whack, not someone. But hey, what do I know? I'm a factory worker.